Hello everyone, and thank you to be here. My name is Alessandro Salsi, and today I'm going to talk about stroke. Stroke is a critical medical condition. This presentation will cover the neurobiology, genetics, clinical presentation, diagnostic techniques, and management of stroke in its various forms. Stroke is the fifth leading cause of death and disability in the United States. It not only brings immense suffering to patients and their families, but also imposes a significant financial burden on society. Let's begin by defining what a stroke is. According to the World Health Organization, stroke is a rapidly developing disturbance in cerebral function, caused by vascular issues and lasting more than 24 hours, or leading to death. There are two primary types of stroke, ischemic and hemorrhagic. Ischemic stroke is caused by clots obstructing blood flow in the brain. Hemorrhagic stroke results from bleeding within the brain. Additionally, conditions like transient ischemic attacks, cryptogenic strokes, and brainstem strokes also meet the criteria for stroke. A transient ischemic attack is a temporary obstruction of blood flow in the brain that resolves on its own. A cryptogenic stroke is a stroke of unknown causes. Lastly, a brainstem stroke is an ischemic stroke located in the brainstem. Let's talk about the neurobiology of stroke. Ischemic stroke accounts for 87% of all stroke cases. It occurs when blood flow to the brain is blocked. This blockage can happen due to thrombosis or embolisms. Thrombosis is a buildup of fatty plaque within the brain vessels. Embolisms happen when fatty plaques rupture in other parts of the body and travel to the brain. In figure 3, we can see a plaque forming directly within the brain vessels. Figure 4 and 5 show how a plaque can form somewhere else in the body and, after rupture, it lodges within the brain vessels. Without treatment, the brain suffers permanent damage due to lack of oxygen and nutrients. On the other hand, hemorrhagic stroke is responsible for about 13% of all strokes. It occurs when a blood vessel ruptures within the brain, leading to brain compression. There are two main types of hemorrhagic stroke: intracerebral hemorrhage and subarachnoid hemorrhage. Intracerebral hemorrhage is bleeding within deep brain tissues. Subarachnoid hemorrhage is bleeding between the brain and the skull. As we can see in figure 6, the bleeding is deep in the brain, whereas in figure 7, the hemorrhage is between the brain and the skull. Although ischemic and hemorrhagic strokes arise from different causes, they share the potential to cause devastating outcomes. Genetics plays a critical role in the onset and progression of stroke. Recent genome-wide studies have identified over 40 gene regions linked to stroke risk. These discoveries highlight the potential for personalized medicine in stroke prevention and treatment. Ischemic stroke, for example, is associated with genetic factors influencing lipid metabolism, vascular health, and high blood pressure. Similarly, genetic predisposition to hemorrhagic stroke include malfunctions affecting vascular integrity and collagen synthesis. These findings pave the way for developing targeted therapies and improved diagnostic techniques. A specific genetic disorder that leads to ischemic stroke is called CADASIL. CADASIL stands for Cerebral Autosomal Dominant Arteriopathy with Subcortical Infarcts and Leukoencephalopathy. CADASIL is a rare inherited disorder caused by a mutation in the Notch3 gene. It leads to thickening of blood vessels walls, reducing blood flow to the brain. Symptoms, which often begin between age 20 and 40, include migraine with aura, multiple strokes, progressive cognitive decline, and mental health issues like depression. Less common symptoms include seizure, vision problem, and Parkinsonism. By age 65, most individuals experience cognitive impairment or dementia. The clinical presentation of strokes varies significantly depending on the two types. Ischemic stroke often presents with aphasia, which is difficulty speaking, motor weakness, either on one side of the body or bilaterally, and sensory deficits. The symptoms can develop gradually, especially during thrombotic events, or suddenly, like in embolic cases. Hemorrhagic stroke, on the other hand, is marked by severe headaches, nausea, vomiting, and loss of consciousness. The contrasting presentations emphasize the need to prompt recognition and intervention to minimize brain damage and improve outcomes. Accurate diagnosis of stroke relies on a combination of clinical evaluation and imaging studies. The gold standard diagnostic tools include CT scans and MRI. CT scans detect bleeding or large ischemic strokes. MRI scans provide more detailed images and can detect small or early-stage strokes. For hemorrhagic strokes, additional blood work, such as coagulation studies, are essential to guide the treatment. Figure 11 and 12 show CT scans of ischemic and hemorrhagic strokes. Here we have two MRI studies. Figure 13 shows an ischemic stroke and Figure 14 an hemorrhagic stroke. Let's conclude this presentation by talking about the management of stroke. For ischemic stroke, the primary treatment is alteplase, a clot-dissolving medication. It restores blood flow if administered within 4.5 hours from symptoms onset. When using medication is not an option, mechanical thrombectomy, a procedure to physically remove the clot, can be used. For hemorrhagic stroke, management focuses on controlling blood pressure, seizure prevention, and surgical interventions, like craniectomy, to relieve intracranial pressure. Thank you very much for the attention.